I was presenting the Active Design Guidelines, a document prepared by the City of New York officially of 4 different city agencies talking about how design and public health issues come together. The 4 agencies represented the same type of interdisciplinary or transdisciplinary discourse that is necessary to solve problems that epidemiologists and public health officials are grappling with all the time, those sort of multivariant problems that don't easily have a simple solution. The idea that different agencies of the city government can come together, health, public works, parks, transportation, to look at problems outside of their silos, outside of their box, was very much the spirit of this conference today. I think the key challenge is consciousness. I think people have problems, economic or social. The idea that people could take forcefully charge of their lives and create conditions where they and their loved ones live better lives, partly through design. It's obviously also for public health very much a question of other factors, sometimes beyond people's control, air quality, water quality, nutritional choices. But insofar as people's choices about where and how to live are based on community design and building design, architects enter the fray. We try to convince people that they could do more, and we could try to convince elected officials that they could spend more and spend more wisely. People become convinced that there's a necessity for change when they realize that it's about everybody's lives, not just about some segment of a population that may be distinct from how they think. Elected officials have the same respiratory problems when the air quality isn't as good as people who are living in very poor neighborhoods. But it can be exacerbated in neighborhoods where there isn't adequate supply of fresh food, or where it's very difficult to find decent lodging. So the income disparities and the questions of social justice come to a necessity to say that architectural decisions and planning decisions have a political content, and that people, to effectuate change, have to think both in political terms and design terms to try to create a better community, a better neighborhood, a better world. The key word that I learned more about today than I've ever heard is about innovation and the challenges of innovation, the difficulties of innovation. How do you make change? How does that change stick? How are those changes possible across the world and not just in the most privileged communities? I'm fortunate to live in a city that's fairly wealthy, but what I took away was the notion that the problems that we face are universal and that the solutions that we need to do together are not based on rich or poor, north or south, but are common because they ultimately impact people's lives and people's health.